Hello, my name's Nick Mann. I'm a GP working in the NHS. I've been a doctor for 27 years and I want to talk to you about the absolute car crash that this government is leading the NHS into.
19 billion more.
£7 billion.
Over £7 billion.
£10 billion.
She actually said, in fact, we gave them more funding than they required. Is that true?
Well, I don't think that is strictly true. The committee felt that a fairer figure, if we're using the usual measures, was actually 4.5 billion, which is a very different number.
So one thing we're becoming pretty familiar with is the Tories saying one thing and doing another. And what's very clear from the official government statistics on the NHS is that we now have fewer GPs than we had in 2009. We're about 9,000 nurses short of where we were in 2009, and the funding per head of population spent on health has reduced inexorably since the Tories have been in power. And we're seeing the effects of that as A&Es fill up. Social care's been cut by £4.5 billion. We've got 500,000 people over 65 unable to access or have had their social care completely cancelled. The government are busy taking 50,000 mobility scooters off disabled people. There has never been less funding year on year put into the health service than there is now. The health service is being shrunk down, and as a result, clinical care will become unsafe.
We're putting £10 billion extra into it.
I'm sorry, Prime Minister, but we have nurses going to food banks at the moment. That must be wrong.
We have, and there are many complex reasons why people go to food banks.
Oh, there are complex reasons why nurses use food banks. No, the reasons are blindingly simple. They are not paid enough to support their families and to feed their families. They're being pushed to work harder and longer and in more difficult circumstances. And when you have a spread of old people in a ward at the end of their lives, you're dealing with people really who need care, they need compassion. Nurses care desperately about the quality of care they're able to provide. And when there's one nurse to 16 patients, instead of the safe level, the maximum safe level would be 8, and there are nurses working to double those ratios. How can they provide safe care to people? And how can the government come down and then blame the staff for not providing safe care? I think if you vote Tory in this election, you are voting for more of the same. You're voting for more cuts to beds, you're voting for more cuts to staff, a dumbed down NHS where you will need care and it simply won't be available. Jeremy Corbyn has said that he wants to halt the privatisation of the NHS, and Jeremy Corbyn has stated that he proposes to introduce and legislate for safe clinical staffing ratios. So Jeremy Corbyn is standing up for a public NHS. He appears to realise the problems that the NHS is encountering now and actually has an idea of what the solutions are. It's a brilliant system that is world renowned and rightly rated very highly across the world. We should be proud of the NHS, and we're busy dismantling it. If you found this video informative or interesting and you're concerned by the issues it raises, then please do leave comments below. We'd be really interested to hear from you. Subscribe to the channel, and thank you very much for watching.